I'm here
Excellent.
today with Dr. Gerard Flaherty. Dr. Flaherty is a physician and professor at the University of Galway in Ireland. Thank you, Gerard, for joining me from so many time zones away.
It's a pleasure, Chris. Thanks for inviting me.
Thank you. So first, I wanted to talk about road traffic injuries. And first, when most travelers think about travel and health, if they have concerns, they tend to center around infectious diseases. So people think about malaria and typhoid fever and yellow fever, things of that nature. What is the risk to international travelers from road traffic injuries?
Well, Chris, this is a very worthy topic, and I think it's somewhat neglected in the travel medicine literature. I know you and I have written an editorial in the past in Journal of Travel Medicine. I think it was just 5 years ago, just reflecting on that. So thank you for covering this topic. It's important. I'm not a world expert on this topic. I have an interest in it, but I can mention some people around the world who are have active research teams focusing on travel-related injuries and fatalities. But it is good to consider what the risk of road traffic collisions, road traffic accidents, motor vehicle accidents is in travelers. But first of all, maybe just preface it by saying there are limitations on the available data. You know, a lot of the studies that we cite report proportional mortality. So they'll say a certain percentage of all traveler deaths in a given cohort were due to injuries, and they'll break down the injuries into road traffic accidents, suicide, drowning, and so on, homicide. They would make up the bulk of all injury-related fatalities in travelers, but it's difficult to compare with a population who are like the traveling population, because people who travel are not necessarily representative of their own demographic. And, you know, those who um, unfortunately suffer, a collision may be different to travelers in general. So without comparator data, without a group that is, resembles the traveler cohort, it's always difficult to be definitive. So, just bear that in mind when we quote road traffic accident statistics. However, we have good evidence that that really you could say injury-related fatalities are the leading cause of preventable death in international travelers.
Leading, number one.
The number one cause with a disproportionate impact on younger travelers. We generally say that older travelers are more likely to die from atherosclerotic cardiovascular disease, which of course is a leading cause of death domestically. Now, that's another podcast, I think. That's another conversation. But certainly injury-related deaths, and particularly road traffic accidents, are a significant risk to travelers. There's significant variability around the world in terms of crash fatality rates. So a traveler's risk of, dying from a road traffic accident in two countries can differ markedly. And we have some understanding of what those factors might be that make a particular country more likely to give rise to fatal car accidents in travelers. Different driving customs, different driving cultures. Clearly, I think Peter Leggett's group, the late great Peter Leggett from Australia, found that of travelers who died in road traffic accidents in Australia, there was a disproportionate number from countries who drove on the opposite side of the road, from right-sided driving countries. So clearly, if people have, a license to drive on one side of the road, and they're driving for the first time, perhaps in a country who drive on the opposite side of the road, they may not take due account of that. It might be a novelty driving away from the car hire company at the airport, but they'll quickly realize that it does take the brain some time to adjust to this. And we do know that that's a significant risk factor. I remember a study in London found even that pedestrians were more likely to be killed, pedestrian tourists, if they were from a country that drove on the right side of the road, so the opposite to the UK.
So even pedestrians.
So, even pedestrians. And of course, the traffic volumes may be greater in some countries, especially in cities, much greater population density than the traveler may be used to. That depends where the traveler is from, of course. Also, the mix of traffic types. We've traveled a lot, and we've seen, road users having to share the roads with rickshaws and animals as well. And the lane discipline may not be what we're used to in our own countries. The road surfaces now. Of course, there are potholes in many countries, but potholes on main roads wouldn't be the norm. But you'll
Right.
see this in some countries, and the tendencies perhaps in some places for lack of street lighting or lack of hard shoulders or guardrails, lack of protective features on roads. So road design varies a lot
Hmm.
around the world.
Hmm.
And so I think the traveler who does decide to drive in another country is putting themselves at risk. I think if they drive too soon after arriving, I always encourage travelers if they wish to hire a car in another country to wait a few days until they've at least got over the jet lag. I mean, that's if they're flying east-west, less of an issue if they're flying north-south, of course.
Okay.
But
Okay.
particularly flying east, we wrote about this before. We just hinted at the possibility that jet lag could be a contributor to road traffic accidents. Certainly stands to reason that that could
Hmm.
be the case. And laws or the implementation of laws in some destinations will be more or less stringent. So people may
Okay.
take chances, perhaps as travelers, drinking under the influence of alcohol or drugs, and then may have to compete with very unfamiliar road conditions or vehicles, perhaps more poorly maintained vehicles. And they themselves are perhaps suffering from travel fatigue or jet lag.
Mm.
Um, you know, Lots of reasons why the car may be unfamiliar. And I often tell travelers, don't underestimate the disorienting effect of looking at signs, directional signs, and so on, traffic signs, in a completely different script, never mind in a completely different language.
Right.
And so,
Right.
again,
Right.
it's just good to make people aware of this in the clinic before they travel.
Okay.
Because it might be something that will take them by surprise, and then it might be rather late for them to sort of take appropriate measures. So yes, it is a significant risk. We I guess we have limitations in the data available to us. These
Hmm.
are some of the risk factors I think that we should be aware of. We shouldn't also forget that about a half or nearly a half of all road traffic fatalities in the world in general, in the general population, occur in more vulnerable road users, pedestrians, as we mentioned,
Hmm.
and also cyclists. And I suppose there's a new cohort of travelers now who hire local e-scooters, electric bikes,
Right.
mopeds,
Right.
quad bikes, things that perhaps they're not familiar with in their own country. But again, it's part of the attraction of travel to try new
Right.
things. And there may be,
Right.
sort of an exaggerated sense of protection, especially if you hire these in countries that you would consider to be as developed as your own. I think
Right.
sometimes travelers overestimate that sense of protection.
Well, actually, I do have a question on e-scooters, but before we get to that, a lot of travelers associate mopeds with traditional travel, say in France or Italy.
Mm.
Motorcycles and mopeds, any safer than cars?
No, I don't think so. In fact, I think motorcyclists are, they're much more vulnerable. They're much more exposed
Hmm.
in the event of an accident. Um, we, Data do suggest that motorcyclists tend to, approach the maximum speed limit or exceed it more readily, and especially in overtaking, lines of traffic.
Hmm.
Um, and when I see travelers who are planning to hire a motorbike, I do always ask about their experience in driving motorbikes at home, but that doesn't necessarily reassure me because, some people are quite different on a motorcycle than they would be in a car, and yet they're so
Hmm.
much more unprotected. Helmets, we know, reduce the risk of fatality by 42%. Um, we found in a study we did in Bangkok with Mahidol University that there is a very poor uptake of helmet use amongst travelers to Thailand who hire get on a motorbike taxi. And it's a very good way to get around Bangkok,
Hmm.
but I don't recommend it to travelers. I
Okay.
recommend they use a licensed taxi because the helmets are often people are reluctant to use them. They may have been used by many people before,
Mhm.
and sometimes they're not even offered. I've certainly seen
Mhm.
examples of people in other countries where the motorcycle driver is wearing a helmet, but passenger isn't. I don't know whether
Mm,
they're even
mm,
offered one. So I
mm,
think motorcyclists are vulnerable, don't have the the same protection in the event of an accident, and they don't always wear proper motorcycle crash gear as well. You'll
right.
often see them in shorts, and again, there's been a big campaign in Ireland. I'm sure it's the same in many countries, trying to target younger motorcyclists, encouraging them to, I think the campaign in Ireland was to lay off the throttle, just to drive a little bit more calmly and not accelerate as much. And I know in some countries that I'm familiar with, including Malaysia, um, unfortunately, every year there's quite a high death toll of young motorcyclists.
Mhm.
So I would discourage
Okay.
travelers from hiring motorbikes, but sometimes it is a popular reason for travel. If they're competent motorcyclists at home, perhaps that's more reassuring. But you mentioned, I think, mopeds as well, or
Yeah, and e-scooters, I'm seeing increasing popularity of e-scooters, e-bikes, and
yeah.
those odd things, I don't know their proper name. They're unicycles on little platforms.
Oh yeah, the Segway things
Is that what
is
they're, no,
I
not
think so.
Segways, they're little flat things. But I'm seeing
Oh
now in some
yes, yes, I
cities,
know those.
such
Yes.
as Paris, and most recently I read Adelaide, Australia, have actually banned e-scooters.
Uh,
And I wondered if you have any general thoughts on e-scooters, e-bikes, things of that nature.
well, is it hoverboards you're thinking of, that other device, and
Is that
people
what they're
control them
called?
from a, yeah, I think so. But
Okay.
but there's so many new vehicles around now. It's hard to keep up. But with the e-scooters, I think the difficulty is if there isn't an upper speed limit. So I think some of them are capable of driving at very high speeds. In Ireland, legislation was just passed in May of this year, in fact, regulating that group of travelers to a much greater extent. Before that, it was a little chaotic, really, and people were driving more and more powerful e-scooters, which were using, in many cases, space given over to pedestrians, so footpaths and so on. And so there's been efforts now to regulate that. Those vehicles to a better extent, capping their speed at 25 kilometers per hour.
Mhm.
Unfortunately, still, there isn't a legal requirement for users of e-scooters to wear a helmet, which I
Mm,
find remarkable.
mm,
They're
mm.
encouraged to wear a helmet, and they're encouraged to wear reflective cycle gear.
Mhm.
Um, but I would prefer if that were mandatory, to be honest. We're certainly hearing of a lot of injuries, some quite distinctive injuries from e-scooters, involving in some cases, collision between high velocity vehicles, trucks and cars. Unfortunately, there have been some deaths in recent years, and e-scooter users, but also collisions between e-scooters and other vulnerable road users like cyclists or pedestrians.
Mm.
They are quite silent, and people, not every pedestrian will hear an approaching e-scooter. Some people are hard of hearing. Very many people, especially the younger generation, Chris, are listening to music on their ear pods,
Right.
and before they know it, there's a vehicle traveling at significant speed on their shoulder. I mean, that's an important point we should try to get across to our travelers is, when you're crossing roads, try not to jaywalk. There's strict rules about that in many countries, some of them in Europe, but also don't cross while listening to music. I just think that is just asking for trouble. Try to cross at crosswalks. Some of the streets in countries they'll visit are much wider than they're used to, and at the intersections are extremely busy. And listening to music or being distracted on their phone, looking down at their phone or following a navigation system on their phone is again to be discouraged. These are the kind of behavioral um, strategies that we can hopefully get positive message about in our travel consultation.
Oh, good. Thank you. Now, next question. This is more asking for your speculation. But if the biggest cause of deaths of international young travelers is road traffic injuries, why do you think that the travel medicine community, physicians around the world, focus so much on infectious diseases and, relatively speaking, neglect non-communicable threats such as road traffic accidents?
It's a very good question, and you and I have pondered this before. Um, I think travel medicine had its origins, if you like, from the within the infectious disease community. The
Mhm.
infectious disease specialists tend to be very well represented amongst travel medicine practitioners. And their focus is sometimes on all phases of travel, but very often on the returned traveler, so the post-travel environment where infectious disease threats are considered. And so perhaps there is a lack of practitioners who have a suitable theoretical or practical background in injury prevention, health promotion. Now, my feeling is that all of us as travel medicine practitioners, no matter what our professional background, should be able to provide pre-travel health advice and should be able to provide advice that reduces the risk of both infectious disease, but also non-communicable
Mhm.
disease or injury threats. So I think this is really should be bread and butter of the travel medicine practitioner.
Mhm. Mhm.
We probably need to find better strategies at doing that because we have a time-limited consultation. Now, of course, travelers may return for second and third doses of vaccines to complete vaccine courses. But I think you need to use those return visits as an opportunity to reinforce certain messages given in the initial consultation, because
Mhm.
travelers' retention of information may be limited. Also supplemented with information in printed form, reference to websites like your own and your own podcast. And the ISTM podcast
Mhm.
as extra ways to educate travelers outside the consultation,
Right.
refer the traveler to good resources. But I think we're trying to address this. I know I did a bibliometric analysis of all articles published in Journal of Travel Medicine in the past, and
Mhm.
less than 2% of all papers published in our leading journal in the field related to the domain of the ISTM body of knowledge focusing on violence and injuries. And so I just think there's a lack of research. And we are moving towards a more evidence-based discipline from more expert consensus to evidence, which is great. Our discipline is really maturing and has achieved specialty recognition in some countries. But with that, I think there will need to be greater emphasis on funding research in some of these to meet these unmet needs. So not to over focus on areas where that might account for a lot of morbidity in travelers,
Mhm.
but in terms of addressing those things that happen to travelers more often and particularly lead to traveler deaths more often, then I think there is a need for greater research in this area, and that for that research to be funded, and also then for that research to find its way into conferences. Now, I will say that at the 18th CISTM conference, if I can mention the CISTM conference that was held in Basel last year, we had a whole plenary devoted to this. I was
Nice.
one of the chairs for that session, and it was wonderful to see it. Um, Peter Leggett, who tragically passed away um, in September 2023, had a real interest in trauma and injuries. And, he's left behind a really vibrant research team in James Cook University in Australia that still looks at this. And so
Mhm.
I think there are a few groups around the world with a real interest in this, but I think we need to see more activity in injuries related research. And I think we probably don't have all of the expertise within our field. We need to partner more and collaborate more with experts in public health, in
Mhm.
transportation
Mhm.
science,
Mhm.
traffic medicine. There's an interest in traffic medicine in Ireland. The Royal College of Physicians of Ireland has an excellent course in traffic medicine, which I've done myself. I mean, so it is possible for us to upskill so that at least we can speak the language of road traffic accidents. And of course, pre-hospital emergency care, this group of practitioners are, really really strong when it comes to dealing with the aftermath of accidents,
Mhm.
our emergency physician colleagues. So we need to partner more with them and perhaps also even engineers because we're talking about road design as well
Mhm.
and
Mhm.
vehicle design and protection of road users. So I think we need more multidisciplinary research that traverses these boundaries rather than trying to manage it all ourselves.
Thank you. That was excellent overview. So it sounds like the trend is slowly moving to a greater awareness of this threat, but it's going to take a while, and there's a lot of inertia involved.
I think there is, Chris. I think there is, and champions like you, who've really, you know, promoted this as an area of interest within travel medicine. I think we will see more reflection of that in our journal articles and in our conferences in the time to come. Certainly, ISTM is or has in fact recently formed a new interest group, which we hope you'll become part of, and it will be led by Professor Richard Franklin from Peter Leggett's group in Australia, which will be focused on trauma and injuries in travelers. So I think it's long overdue, and I think that will be a very vibrant group, and hopefully some of the research and scholarship will come from that group, and then hopefully permeate the wider travel medicine community.
Excellent, thank you. Well, Dr. Gerard Flaherty, University of Galway, Ireland, and I want to thank you particularly. You're having an extremely busy year. I should have mentioned in the introduction, Dr. Flaherty is now president of ISTM, which is the major international travel medicine society. ISTM is International Society of Travel Medicine. How many members and how many countries are now part of ISTM?
Oh, well, at its peak, ISTM had over 4,000 members. Now, the COVID pandemic certainly dealt a blow to our membership and to our activities. We did our best during that difficult period to provide a good service to our members using, virtual education methods, and some of which have actually remained. And so we have a nice hybrid offering now of both in-person and virtual events. We're slowly building up our membership, but hopefully we'll reach those heights again. We're also trying to expand our membership as well to include more non-traditional member categories, including the layperson. The layperson, we're all travelers, of course, but the bulk of travelers are not travel medicine specialists, and so I think we're trying to make ISTM more relevant to the lay traveler, because people, when they travel, they don't always go to a travel clinic. Less than half of them do, we think. And therefore they use other methods to educate themselves. They often come to the clinic, very well informed, but sometimes misinformed, because there's been some misunderstandings in relation to the information they've read. And I think we need to do more to reach out to them. And we're certainly doing that. And I know the podcast that you're responsible for with your colleague in University of Washington, that is the kind of thing we need more of. But it has to reach that target group, and especially when we're talking about road traffic accidents, giving the right advice to vulnerable road users could make a huge difference in terms of reducing not just fatality, but also injuries. We shouldn't forget that for every one death on the road, there's typically 20 to 50 injuries. We don't really have a good sense of the injury breakdown in travelers. We have some data on that from Bermuda and other places, but not a whole lot. So there are a lot of travelers who get injured during travel. Perhaps we only hear about the deaths or the high profile deaths often in media reports, but there's a lot of people who are badly injured, severely injured. And again, they face the additional challenge of maybe limited local emergency medical infrastructure, pre-hospital medical transportation. Of course, some are not even insured, don't have travel health insurance, which is again another topic. But these are all the reasons why it's really good to elevate this topic and to involve the public in the conversation. So that's why I was really delighted to respond to your invitation to speak to you today, Chris.
Gerard. Thank you again for your time today. Good chatting.
It's a great pleasure. Take care. Bye-bye.
Thank you. Bye-bye.